Before beginning the whitening treatment, first, treat areas of concern, including but not limited to exposed dentin and decay. Place protective eyewear and clothing on yourself and the patient, and record the patient's initial shade. Ensure that the syringes are securely attached. Depress the small clear plunger completely into the middle clear syringe to rupture the internal membrane and combine the activator with the whitening gel. Push the stems back and forth 25 times on each side to thoroughly mix the activator and gel. Press all the mixed gel into the red syringe. Twist to separate the two syringes and securely attach the black mini tip to the red syringe. Verify the flow, consistency, and red color of the gel away from the patient before applying intraorally. If resistance is met, replace the tip and recheck. If the gel is not red, do not use and refer to the instructions for use for further information. Remove the luer lock cap from the Opalescence resin barrier and securely attach the recommended delivery tip. Verify the flow prior to applying intraorally. Place the umbrella retractor and the Ultradent Isoblock bite block. Rinse and dry the teeth and gums thoroughly. Apply Opalescence resin barrier along the gingival margin, overlapping approximately 2 to 3 millimeters onto the enamel. Express through any open embrasures to completely cover exposed pupilla. Begin and end the barrier one tooth beyond the most distal tooth to be whitened. Use a mouth mirror to verify that there is no exposed gingiva. Light cure the resin using a scanning motion. Carefully check the cure. Apply a 0.5 to 1 millimeter layer of mixed Opalescence Pro whitening gel. Allow the gel to remain on the teeth for 20 minutes per application. Periodically check the patient's comfort and suction saliva. To remove, suction the gel from the teeth using the Luer Vac and SST surgical suction tip. Do not use water while suctioning gel to avoid splatter. When no gel is visible, lightly rinse and air dry. Do not dislodge the isolation barrier. Evaluate the shade change and repeat the application steps if needed. Do not exceed 3 applications per visit. Retreat as necessary using professional judgment. If persistent sensitivity or irritation occurs, discontinue use. Gently slide the tip of an instrument beneath the resin barrier to remove. Wait 7 to 10 days after whitening procedures before placing adhesive restorations. See IFU for complete instructions.